May we now then turn to item 5 on the agenda, which is the performance report. I'm going to invite Simon to say a few words of introduction.
Well, so I think these next two items are effectively a look back on 13-14, and so obviously the principal goals that we have as an organisation are specified through the mandate for which we're accountable to the government and to Parliament democratically. So this is a look at those goals during 13-14. I'm going to ask Karen to kick off, and then Barbara, and then we will go on to the financial aspects of this in the second paper, and Paul will talk us through that with a particular reference to specialised commissioning, which obviously was one of the big pressures in 13-14. So when Karen and Barbara have talked about the first part of this, I might also just ask Jane, since we referenced Winterbourne View in the 13-14 position, just to give a short update on where we stand on that. So, Karen, do you want to?
Yes, just to kick this off, firstly, say I don't take any credit for this report. This reflects, obviously, the work of the organisation over the last 12 months, and it's a complex picture because it tries to bring together and represent both what NHS England is seeking to achieve through its mandate and its outcomes, which is essentially NHS performance. And I'll invite Barbara to talk about that in a second. But the second part, which I will say a few words about, is about NHS England performance, which is obviously our role in trying to underpin and deliver those mandated outcomes and that performance. This report, we've tried to simplify it this year to make it a more meaningful and useful report for the board. I think we've more work to do on that to try to provide you with a more meaningful dashboard of metrics and measures so that the board can use that to make meaningful decisions and get an overview. So I think we're still very much working on that, and I'd expect this to change again the next time we bring it back in July. But on NHS England performance, at the moment we've just focused on the business plan. I haven't got anything specifically to say about that, about the completion of the work on the business plan and a number of items which have now moved into the next year's business plan. And the contact centre performance, which of course reflects our progress on complaints and customer inquiries and also FOI inquiries. And there's a significant increase in the volume of complaints and inquiries that we've had, 17%, and an improvement generally in the customer service that we're delivering there, although I think we've got some way to go to properly move on our performance in terms of closing out and dealing with complaints as effectively. I would hope that in our future performance reports on NHS England we would also be able to say something about NHS capability, because we need to look to the future on capability for the future, and that's part of the organisational work that we'll be doing. And secondly, on reputation or stakeholder management, and I don't have anything to say on those right now, but I think those are important factors on our overall performance. So that's all I was going to say about NHS England performance, and Barbara, if you'd like to touch on NHS.
Thank you. Thanks, Carol. And if I could draw the board's attention to pages 4, 5 and 6 of the report, which is where we've summarised the things that NHS England is responsible for ensuring that the services delivered to patients. It's a combination of patients' constitutional standards, their rights to be seen promptly, and a variety of other things that are in the mandate to NHS England, but the sorts of things that I'm sure everybody will be aware are really, really important to patients and the population. The number of patients who are getting the right immunisations and vaccinations, screening programmes, so the full range of things that we need to support the NHS to deliver for our patients to improve both their health and make sure that they have great health care. It is a look back on the year, and I think that if you look at the report as a whole, we need to see this as a testament to the hard work of staff in the NHS who, with an inexorable and increasing rise for the need for services for our patients. We've got an ever-increasing population, an increasing number of frail patients, and an increasing range of interventions that we can do to help them and make them better. And put all that together in times of economic restraint, then I think we need to say a really great congratulations to our staff out there in the NHS and all the people in NHS England and in support organisations who've helped those frontline staff to deliver what I think is really a very good record. As you will recall, last year one of our biggest concerns was the rise in urgent care and the pressure this was putting on our A&E services. NHS England, working with its partners in Monitor, the Trust Development Authority, and with local government, and we work together both at national and regional and at local level, put a huge amount of work into supporting urgent care working groups to identify how we could improve the services for patients so that fewer of them, if they didn't need to go to A&E, didn't have to go to A&E, that if they needed to be admitted to hospital as soon as they were well enough to go home, they could be discharged home, but also making sure that the services within the A&E department were efficient so that patients didn't have to wait any longer than they needed to. I know everybody, the 4-hour figure is quoted, but I think that hides. I think it is really important that patients don't, apart from a small number of patients who have a clinical need where it's important, that we do maintain patients don't have to wait any longer than necessary. But I think, the average, vast majority of patients are seen, treated and discharged. It's not just about being seen in 4 hours, it's about having your treatment completed in 4 hours. And for the vast majority of patients, this is a much, much shorter time. And for this year, for 13-14, the NHS met that standard in every quarter and for the whole year, which I think is a really good marker that patients turning up to our A&E departments, for the most part, all got a really good and prompt service. But we're not complacent. There's a great deal more work to do on urgent care, and that includes not just what's going on in our A&E departments, but it also includes supporting our ambulance trusts in the vital work they do. And again, from the report, you'll see that there were still some issues around some of the standards we'd like to see achieved for our patients across all ambulance services. And again, that is mainly about being seen, about the ambulance arriving promptly, depending on your circumstances. But despite the fact there's more work to do, we have seen an improvement in what's happening with our ambulances. As the Chief Executive mentioned earlier, one disappointing thing towards the end of the year was that the times it took the NHS to complete or to initiate treatment for patients for planned care, for elective care, the number of patients on the waiting list has risen, and the standard we are set is that 90% of patients who are treated, who get their treatment, if it's a surgical treatment, should be treated within 18 weeks, and only 10% should wait longer than that. There are times when clinically there are some patients for whom it's just very difficult to treat within that time. The NHS has done well with this for some considerable years, and sadly towards the end of the year this standard was missed. I think it's really important to recognise that this is due to a significant increase in need of patients for treatments, and this is not about our NHS staff not doing a really great job. It is a demand and a need which we need to respond to. So again, as the Chief Executive said, we, working with our partners in TDA Monitor and across the NHS and local authorities, will be putting in place a programme of work that can get that back on track and make sure patients don't have to wait. But inevitably, if the volumes of patients who are on the waiting list increases and patients who have waited for a long time need to be treated, it is likely that it will take us a few months to get this back on track. So I think there's a phase of how do we increase the capacity, how do we make sure that we as commissioners are purchasing enough activity, how do we support our providers to be able to undertake that activity, and I think we will need a few months to make sure that those patients who have waited longest, who need to be treated, we can do that over the summer, which is the appropriate time before we get the busyness of the winter period with urgent care, so that we can put the NHS back on track for steady delivery from the autumn. So that's really important for us. I think another couple of areas areas I would like to pick out, because they are areas of success for the NHS, is particularly the reduction in mixed-sex accommodation breaches. Again, our patients have told us that's really important for them, that they're not inappropriately seen and treated in mixed-sex accommodation. And I think to have reduced that by 46% over the last year is excellent. We've had a reduction in cancelled operations and a reduction in patients waiting a very long time. There are some other areas where we have concern, and we'll continue to monitor closely. There are some areas where at the moment we really don't have the sort of information we'd need to be really confident. So again, if I could take you to the areas of IAPT and dementia diagnosis, both of which we know are really important for patients with mental health issues. And at the moment, our aim is to achieve something in the future on these, and I think that the information flows need to be better, so that we're absolutely certain we're on track and on trajectory, and we can put in all the measures that we need across the country to make sure that patients are diagnosed properly for dementia and have access to that treatment. And then finally, another one that we'll probably have drawn attention to in the paper, would draw attention to, is Winterbourne View, which I wonder whether Jane would be happy to say a few words about.
Okay, thanks, Barbara. I think the most important thing to say today is that we are publishing the second quarterly data collection. This is for the quarter up to and including the 31st of March, and this is the second time we've done this. That clearly shows that although there has been some very slight progress, it's not what we would want and not what we would expect. I think what really brings it home is if you spend time, as I have done, talking to families and listening to their experiences about their children, their brothers, their sisters, their family members that are actually inpatients across the country, and you hear some of their experiences, it really does bring home what is the importance around this piece of work and around what we're doing following the Winterbourne View experiences. And the issue for them predominantly is about actually having the right support and the right level of care as close to home as possible. Some of these people will inevitably be in inpatient settings, but it has to be what is right for them. We've had too many stories of individuals being cared for hundreds of miles away from their homes, and not being able to provide a local service that enables them to come back. And that is very frustrating for not only the people that are in inpatient settings, but also for their families that are desperate to get them closer. So we are making some progress, but it's not fast enough. So the latest set of figures we've got show that we've got 2,615 inpatients. That is a slight increase on what was reported in the last quarter, but this time we have had 100% of CCGs actually giving us the information, and last time we didn't. So I think it is difficult to have a complete comparison. Of those, 182 have got a planned transfer out of inpatient settings by the 1st of June, and 74 have got a planned transfer date after June. The other thing that has improved slightly is that 99% of patients have now got a named advocate, and that is something that's really important in terms of being able to provide those individuals with support and to help challenge. I think what was interesting is that of the sort of 2,350 of people that haven't got a planned transfer date, the reason given is that that's a clinical decision. And I think that means that we need to do some more work with clinicians and commissioners and providers to understand why that is the case. And certainly the work of the Improving Lives team has been very significant in being able to challenge some of those decisions, but also to look at developing services that can be wrapped around people and enable them to be discharged from inpatient settings. So I think there's a couple of things that we are looking to do. We've strengthened the programme governance within NHS England and across with our other key stakeholders like Department of Health, LGA, CQC, etc. But what we really want to do is review the options we've got to have a closer and better relationship and a new approach to working both with people with learning disability, but their carers and families, and also those experts and organisations such as the voluntary sector, third sector, that actually spend time with those people and really truly understand some of those issues. So we're looking at options at the moment to see how we can bring people together better so that we can actually end up with the outcome that we want to achieve. So we're going to go away now and spend a bit of time looking at that, and we'll obviously be able to report back at future public board meetings. I don't know whether anybody's got any questions, or whether, Simon, you wanted to add anything to what I've just said.
Well, thank you. Can I invite any comments or questions from other members of the board to this paper? No?
Or we could go on straight to
Why don't we do that?
finances and then do 13, 14 around. Oh, Kieran had a question.
It's just a very quick comment. I like the simplification of the report. It tells us very well how NHS England as a machine is doing. It tells us very well how the NHS as a machine is doing, how our special projects are doing. The next evolution for me is how are we doing about outcomes, and how do we know that these things will improve outcomes in the way we need. And I know that's a big ask, but actually that's where we need to get to.
I just comment on that. I mean, same reaction actually, Kieran, because if you look at a lot of our data feeds for this, I mean, it's kind of 9 months, 12 months out of date because we're reliant on data capture from others. And I think one of the things we need to do in our sort of 5-year forward view as we think about the contribution we can make to the health of the nation and that the NHS can do is actually quantify that more tangibly and be more specific about the mechanisms of action that we think are going to get us there. Not all of which, in terms of health improvement, are going to be within our grasp, clearly, but many of which could be. And when you look at the proxy measures that we are using, I mean, we are at the moment just dependent on what happens to be out there. So, you know, I'm absolutely certain that health gain for people having elective groin hernia surgery is an important contribution to the health of the nation, but it's probably not the only, let alone the most significant measure that we should probably be tracking in that domain.
Okay. Yes, Mara.
That was a very helpful report from Jane about Winterbourne View, but when will be the next time? I don't think we should, as a board, lose sight of this, but you know, it's obviously the right time for a future report.
I would anticipate that we can report back until such time as the board decides otherwise every board meeting in terms of where we are.
I think we should do that.
Thank you.
Jane. Victor?
Just very quickly on your last remark, really to build on what has just been said, there is a willingness amongst both providers in the not-for-profit sector to engage with you in a solution-focused way, not just to stand at the sideline. I'm just offering that, and just to support the idea that you could be engaging with providers in a more strategic way, because I think solutions to this aren't just about the governance; they're about actually moving people into better services. So if you're open to that approach, I'm sure that there are people out there wanting to talk to you.
Yeah, I think there's two things. One is that we're definitely open, but actually would welcome it.
No, I'm not asking you to do that. I'm asking you to be open to the approach.
Yeah.
I'm quite keen on any of these things that we create some organisational learning from them. So I think it would be quite useful to have a brief note sometime as to what we have learnt from something as complex and challenging as Winterbourne View, and what that then means for other things that we might do in exactly the same way we did with NHS 111 and other things. Because if we don't do that and we don't learn organisationally from those events, then quite frankly we'll have repeat instances. So if we can build something like that in as a loop, it would be really helpful.
Again, so I'm not wanting to be overly bureaucratic, but I think it could be useful when we're thinking really about really the impact of the frontline staff who are so critical here, just to have a tie-in on staff morale. So in other words, opinion surveys from the staff on where we are, and in particular if you think, for example, about the impact of health visitors and retaining health visitors, and the use of agency staff and so on. It would be really good to be able to tie in the results of surveys that we carry out on how the staff are feeling into the overarching performance report.
Right, well, thank you. We'll take that on board. I think that to give that overarching view would be very valuable. Karen, I think you're
Yes.
nodding with acceptance of that.
Thank you.